Good evening, Dr. Smith. I just wanted to take a moment of your time today to consult you about one of your patients. Her name is DM. Her date of birth is 12/23/1974. She returned to the clinic today for a reading of her MAN2 TB test, which read greater than 15 millimeters in duration after she visited India recently. The patient has a past medical history of seizures and alcohol use. She's currently being treated for her seizures with carbamazepine. Her physical exam was unremarkable, and the patient denied fever, dyspnea, and cough, additionally to note. Her chest x-ray was also negative for lesions and cavitations. Laboratory results showed elevated liver transaminases to note in therapy management. Isoniazid was ordered for 9 months. However, isoniazid has a black box warning for increased risk of developing hepatitis, especially with alcohol consumption and other agents that elevate the risk of hepatotoxicity. Isoniazid also has a major drug interaction with carbamazepine, as concurrent use with carbamazepine and isoniazid may result in increased carbamazepine concentrations and increased risk of isoniazid-induced hepatotoxicity. At this time, it is recommended to discontinue isoniazid therapy because of this interaction, and to start rifampin at a ceiling dose of 600 milligrams orally daily based on the patient's weight of 84 kilograms. While rifampin is not a first-line therapy, it does pose less of a drug interaction with carbamazepine to ensure that her seizures remain well controlled. A switch to from acetaminophen to ibuprofen is warranted to decrease the risk of hepatotoxicity during rifampin therapy concurrent with carbamazepine. The side effects of rifampin therapy include agranulocytosis, hepatotoxicity, and renal failure to watch out for. The monitoring of liver transaminases should also be performed, as well as bilirubin, CBC, platelet count, and serum creatinine. Monitoring of liver transaminases should also be performed, as well as performance for monitoring of seizures. In addition, carbamazepine levels should be collected, as rifampin therapy may decrease the efficacy of carbamazepine. AFB smears should be collected in 2 months from now, whereafter rifampin therapy has been started, and from that point on, it may be continued an additional 4 months. It is recommended to encourage the patient to keep alcohol use to a minimum, and this will help to decrease her seizure risk while she's on rifampin therapy, especially concurrent with carbamazepine. An increase in carbamazepine dose while on rifampin may be warranted if there is increased seizure activity occurring. Thank you very much for your time. Feel free to contact me with any further questions that you have.